What kind of health risks do people face during tornado cleanup?
Well, there are a lot of health risks associated with tornado cleanup. I remember back during Hurricane Katrina, I did a lot of work with the local news, television, and radio because a lot of debris was out and about. There was a lot of standing water, which can harbor a lot of dangerous microorganisms. But the take home is if you're somebody that's involved in the cleanup, the most important thing to remember is you want to limit exposure, especially to standing water, because standing water, as I said, can harbor a lot of microorganisms that could be very dangerous, but also snakes can lodge inside of the standing water you cannot see that are coming in from the tree lines, also rodents. These are things you have to really consider. So you want to wear your high level boots that go all the way up your knees so your skin is not exposed to that water, but also inhalants. A lot of mold and mildew can start to build up and you can inhale it. If you have chronic lung disease such as COPD or emphysema, bronchitis, those types of chronic lung disease that can be exacerbated. Also asthma can be exacerbated as well. So these are things you want to think about and limit exposure as much as possible. Also, you want to limit children and elderly from getting involved with the cleanup because they have a higher tendency to get ill.
Dr. Quinn, is there any particular symptoms that people need to look out for after they've been out working around some debris or anything like that?
Most definitely. I mean, the most important symptom you want to look for, especially dealing with inhalational illness, such as if you have a history of asthma or chronic lung disease, if you start developing shortness of breath, that's something you really want to pay attention to, because if you're starting to have that shortness of breath where you just can't catch your breath, if you have your albuterol inhaler, you want to go ahead and use it. But most importantly, you want to remove that person from the area. Actually, it's actually not a good idea to have somebody in that area if they have pre-existing lung disease. Also, fatigue, dizziness. Also, you have to worry about what are called puncture wounds, because with those boards and the nails coming out, you spoke about stepping on a nail. Mm-hmm. If you cut the skin, you want to clean that area as soon as possible. But if it starts getting red and tender and swollen, you want to go ahead and go get checked out by your medical provider because you might need antibiotics. But the take home is you want to limit exposure as much as you can, especially if you're someone that's vulnerable, someone that's elderly or young children or those with chronic lung disease.
It's interesting, Dr. Quinn, that you mentioned the water, because yesterday when I was out there, there was a water company out there from Leland, Mississippi, and they were turning off the meters. Where the meters could be located, they were turning off the water because the water was seeping up now, and it was puddling up in different areas of that. So, yes, you wouldn't think a lot of water there because they're not on the coast or anything like that, but yes, there is water out there too, and they have to be careful. What is the American Lung Association suggesting people do to stay healthy?
Right. I actually have a news press release from the American Lung Association. And they're noting some of that water can hold chemicals, sewage, oils, very dangerous contaminants, including gas. So that's important. Also, they noted that they can have falling power lines in the water where there can be, electrical shock if you're exposed. So you really want to stay away from that standing water as much as possible. Also, just some notes from them. You don't want to burn debris or waste, okay? You want to arrange for it to be picked up because that can cause a problem. Use soap and water for cleaning. You don't want to use the bleach because that can make it difficult for inhalation. When in doubt, toss it out. For instance, children's toys, maybe it's a little teddy bear. They love that teddy bear, but it's soaked in water. In that case, throw it away. Anything that has water in it and it can soak the water up, throw it away, because it can definitely have mold on the outside and on the inside that can be dangerous to your children. And lastly, they just noted, consider hiring professional cleaners if you can get it in your budget, because that way they're trained to safely sanitize and clean your area, and that'll give you the highest level of protection.
Dr. Timothy Quinn, Quinn Healthcare in Ridgeland, Mississippi. Good advice, good tips. Thank you, sir, for being with us today.